Hi, my name is Joseph Manacop, and this is my video of drawing up medication from a vial and administering a subcutaneous injection to a patient. First thing we're going to do is do hand hygiene. We enter the med room towards our med cart, and we're going to pull the patient that is due for a 12 o'clock medication. First, the patient's date of birth, patient's name is diabetes. Date of birth is 12/12/50, and the medication that is due at 12 is aspart insulin. So we're gonna grab it from the med cart, aspart insulin. After we assess the right patient, we're gonna make sure and assess the appropriateness of the drug. From my sheet here, which I'm pretending to be the MAR, diagnosis is blank. If this does happen, that diagnosis is blank in the MAR, it might just be a fluke or a typo. But before you give any medication, you confirm doctor's orders. You look at the patient's medical record. Worst comes to worst, you have to confirm with the provider. You can call the provider, last case scenario, and confirm if the patient is diabetic. Now, for training purposes, the patient is diabetic, and the scheduled medication is aspart insulin. We will talk about aspart insulin. Aspart insulin is an anti-diabetic. It is a pancreatic hormone. It is a rapid-acting insulin. It is given subcutaneously, and the dosing depends on the sliding scale. This medication is given for patients with type 1 and type 2 diabetes. It is used to lower blood glucose levels. A few things that you have to check, of course, check the patient's vitals, make sure they are within normal range, as well as the blood glucose levels. After this medication is given, or even before, you have to check if for any signs of hypo or hyperglycemia. It's mostly change of level of consciousness, fatigue, and some other symptoms. Also, try to check their meds, make sure it's not contraindicated. Some medications like beta blockers, steroids may increase the blood glucose levels. Right here it says that the patient's blood glucose level, the current one, is 128, and through the sliding scale it says that between 100 and 150 the patient should be given 4 units. Since 128 is between 100 and 150, the patient will receive 4 units. Also, the patient, it says here, is allergic to Levaquin. Levaquin is an antibiotic. We are not giving the patient Levaquin. We got to check and make sure that the vial or the medication is not expired. So you check for expiration date, make sure the vial is intact, make sure there's no cracks or it's not opened or anything leaking. And then we're going to do our first 6 rights. We're going to check the patient's birth name. We got diabetes, date of birth is 12/12, aspart insulin, sliding scale given subcutaneously, and it's going to be given at 12 o'clock, which is right now. After doing our first med check, for our first 6 rights, we're going to go ahead and gather our supplies. Make sure you have your vial of insulin, the needles that you need, an alcohol pad, a pair of clean gloves, and a banana. After gathering all these supplies, we're going to move towards the patient's room, just right outside, to do our second med check, or our second 6 right, checking our 6 rights. Again, patient's name is diabetes, date of birth is 12/12/50, aspart insulin, sliding scale. Again, patient's blood glucose level is 128. That's between 100 and 150. It says here, per sliding scale, a patient's going to be given 4 units of insulin. Route is subcutaneous, and it needs to be given at 12 o'clock, which is right about now. So after doing the med check, the second med check, we're going to enter the patient's room, make sure we introduce ourselves, knock on the door. Hi, my name is Joe. I am your nurse for today, and I am here to administer your insulin. Is that okay with you? And the patient consents. We explain the procedure. It's going to administer this insulin with you. Your last blood glucose level was 128, and per the sliding scale, it's between 100 and 150. You are going to be receiving 4 units of insulin. After the patient consents, give the patient some privacy, do some hand hygiene, and ask the patient, what is your name and date of birth? While you are checking the patient's wristband, the patient says, diabetes 12-12-50. You check diabetes 12-12-50. You also check the MAR, diabetes 12-12-50. Okay, now we're going to do our third and last 6 rights, not including the documentation, no. So diabetes 12-12-50, aspart insulin, dose is sliding scale, route is subcutaneous, and 12 o'clock is supposed to be administered at 12 o'clock. We already checked the patient's the medication appropriateness. Vitals are okay. We know the blood glucose level. We know that we're going to give the patient 4 units because of the blood glucose level. Medication is not expired. We are going to draw the medication from the vial. So here's the vial. Make sure it's laying on a clean, flat surface. You're going to pop the either metal or rubber cap. Hold it firmly on a flat surface. Scrub the top of the vial. After scrubbing the vial, you are going to grab your needle with the VAD. For training purposes, this is just a regular insulin needle. I'm just going to pretend that it is a syringe with a VAD. So you uncap it, place the cap on a clean, flat surface, and you're going to draw. It says there are 4 units of medication, so you're going to draw 4 units of air. The line right before 5 units, right there. You're going to if it doesn't have the VAD, you have to take out the regular needle in there and place the VAD in there. Make sure you hold the vial firmly straight. You press the needle and syringe in. Make sure it is not on the liquid itself, and you slowly press the 4 units of air in there. After that, you're gonna invert it. Make sure the tip of the needle has medication in it. It's under or submerged under the medication, and then you're gonna draw 0.4 units, not 0.4, sorry, 4 units. 4 units, again, confirm 4 units of the medication. If there's air, you can tap it, and once you're done, you're going to withdraw it straight. Place that there. You're going to pull a little bit of the medication in, just to make sure that the dead space on the VAD is empty and all that medication that's in the VAD is back in a syringe. You're going to recap it, unfortunately. Take out the VAD and put a new cap in there with the needle, the right needle, which is I think it's 0.3, 0.5, and 0.1, or 0.3, 0.5, and 1. And make sure you advance a little bit of the medication inside the needle on that dead space. And again, I'm not too fond of it, but safely recap it. So you're gonna check the medication eye level straight. Make sure you got the right dose in there, 4 units. You're just gonna set it aside for now, and then we're gonna get the patient ready for the subcutaneous administration. What we can do is lay the patient in a comfortable position. If it's flat, make sure you put pillows underneath their legs. Make sure the side rails close to you is pushed down, or not pushed down, but pulled down. Expose only the injection site. And make sure patient's privacy. And after that, you know what, I forgot. Got the right. And then we're gonna do hand hygiene again. Put our clean gloves. And pick the sites, either the like lateral aspect of your forearm right here. It can also be given on the anterior aspect of your thigh. I prefer the abdomen, so just expose the abdomen. Get either alcohol swab or here's the banana. Oh, needle down. One thing is too, after you're done with the VAD, make sure you dispose that in the proper sharps receptacle. So you're gonna pinch on the patient's skin and the abdomen. How about we clean it up first in the circular motion going outward, and then you let that dry. You pinch it up in the abdomen. Maybe you can do that first. Open up take out the cap, make sure the needle is out of your way. Pinch it up. You can either give it at a 45-degree or a 90-degree angle. So you pinch the skin. I don't know if you can see it. Pinch the skin, either 90 or a 45-degree angle. So we're gonna give it 90 degrees. You're gonna inject it really quick in one smooth action. You're gonna hold it with your non-dominant hand and then push the medication in, and then make sure when you pull it out straight so the patient won't have any discomfort, and you got to get rid of that in the sharps. After you get rid of that in the sharps, you can go ahead and blot the site. After blotting the site, you cover up the patient again, put him in a position of comfort, make sure you put the side rails up, you get rid of your supplies, either trash or sharps. You document on your med cart, and make sure the patient has their call light close to them. Ask them if they need anything else. Do hand hygiene and thank the patient and tell the patient goodbye and move out. And that is my my video for drawing up medications from a vial and injecting medications not intravenously, subcutaneously. Thank you.